Our beloved pets provide us with unconditional love, companionship, and everything in between. But as they age, their needs change, and it's our turn to take care of them. From special diets to mobility support, senior pets require extra love and attention. But how do you know what's best for them? And how do you make sure they're still living their best life? Today, we're providing advice on taking care of your senior pets, as well as answering your pet related questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health-related questions. I'm Dr. Joy Carter, coming to you live from Veterinary Emergency Group in Fort Lauderdale. And today we're going to discuss all things you need to know about taking care of your pets as they get older. Our first question of the day comes to us from Lanny, who reached out to us through our website, allhealthtv.com. Hello, Dr. Carter. We have a cockapoo mocha who's about to turn 10. I'd like to know, what are the most common health issues that senior dogs face? Hi, Lanny. This is a really good question. Okay, so as far as issues that senior dogs face, arthritis is going to be one of your top ones. As you know, you do tend to see that more in your larger breed dogs, but certainly in some of your small and toy breed dogs, you can see that also. Okay, kidney disease is another one. We do tend to see it more in cats, but certainly it can see in dogs also. Periodontal disease, or basically dental disease, that tends to be a bigger problem in our small and our toy breed dogs. That's why regular dental cleanings are very important for pets as they start to age. Basically, heart conditions such as mitral valve prolapse or going into heart failure, that is something else that we see in senior dogs, and you tend to see that in more small and toy breed dogs also. Other types of endocrine disorders or disorders to do kind of with hormones, such as Cushing's disease, diabetes, hypothyroidism, where the thyroid levels are too low. You can see that in older dogs. And then hyperthyroidism, you can tend to see that in older cats. So hopefully your cockapoo doesn't have any of these issues, but hopefully this answers your question so you can kind of know what to look out for with Mocha. All right, our next question comes to us from Dawn, who reached out through our Facebook page. Hi, Dr. Carter. We have a Persian cat, Anahita, who's getting on in years. Our question is this: are there specific vaccinations or preventative treatments that older cats need? Hi, Dawn. It's a really good question. Thank you for watching this show. So as far as vaccines, the vaccines are going to be the same when they get older as when they are younger. Now, if your pet has some type of autoimmune condition, or unfortunately maybe was diagnosed with some type of cancer, then vaccines may not be recommended. And that is something that you can certainly speak with your primary veterinarian about. As far as, other things, for older cats and treatments and things like that, I'm going to talk about it maybe a little bit later, hopefully, but there are some new treatments for arthritis in cats. One thing I definitely recommend for cats is having yearly blood work done once they start to get over the age of 10. Cats are very good at hiding disease, okay? A lot of times they don't show that they're sick until they're very, very sick. And so if we can pick up things like hyperthyroidism, kidney disease, diabetes, things like that, if we can pick up on it when it's very early in the course of disease, then we're better able to treat it and hopefully extend their lifespan. So hopefully this answers your question for you, Don. All right, we just got another question from Facebook from one of our loyal viewers. This is from Kyle. Hey Doc, our Mastiff Zen was diagnosed with arthritis. We'd love to know what kind of treatments and lifestyle changes can help make him more comfortable. Hi Kyle, this is a really good question. So there are a lot of new things that just recently came out on the market for pets with arthritis. In particular, there is an injection that is given monthly. In dogs, it is called Librela. and in cats is called Silencia. Most veterinarians offer these injections. It basically inhibits something called the nerve growth factor. And the nerve growth factor has to play a role with pain and inflammation when it comes to arthritis. I personally have not given these injections because I work in the ER, but I know a lot of general veterinarians that have given these injections, and I have spoken with clients that have given these injections to their pet, and they definitely do recommend it. The other type of injection that has kind of been out on the market for a little bit longer is something called Adequan, okay? This basically is an injection that helps rebuild and helps prevent the breakdown of cartilage. It's usually given once or twice a week for about a month time period, and this is something that would be done at your veterinarian's office. Other things out there's a new type of non-steroidal anti-inflammatory drug. It's called Galliprant that is for dogs. Can be given on a daily basis. It works very well, and it actually has benefits in the sense of that it doesn't affect the liver, the kidneys, the GI tract, like some of our older NSAID drugs, such as Rimadyl or Carprofen, meloxicam, Previcox, Duracox, things like that. So it's a little bit safer for our older pets. Another thing is acupuncture, okay? There are veterinarians that are trained in acupuncture, and there's a lot of veterinarians that are actually doing that. So that is something that I definitely recommend. If your veterinarian does not provide that service, please ask them, or you can Google. And there are definitely a lot of veterinarians in the South Florida area that do offer acupuncture. Some of them will actually come to your house and do it on your pet. Another thing that's been out there and we use in human medicine has been stem cell therapy, and they're starting now to use that in pets. So, good thing is, Kyle, if your pet is suffering from arthritis, there are a lot of new treatment options out there to make your pet more comfortable. So, thank you for asking that question. And in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us from Jose, who reached out to us on Instagram. Hola, Dr. Carter. Our Chihuahua Pepito can't see well, is mostly deaf, and suffering from diabetes. When is the right time to put him to sleep? Trust us, we're not in any rush, but we don't want him to suffer. Hi, Jose. This is a really tough question, but this is my thoughts on this. Okay, so there is basically a quality of life assessment kind of chart or scale that you can go online for your pets. In particular, there is a company called Laps of Love, and they offer that on their website. It's a questionnaire that you answer, and basically you answer several different questions and you put a number beside it if it applies to your pet or if it doesn't. And then based on the scale, kind of lets you know if maybe it should be time to talk to your veterinarian that your pet may be suffering. All right. Now, I will say things that are very obvious for me as a veterinarian that show me that it's time that your pet is suffering would be a significant decrease in appetite, or basically complete lack of appetite when they normally were eating very well. If they appear to be in pain quite a bit, if they're whining, crying, if they're not able to get up, move around, even like just go to the bathroom, eat, do like normal functions, if they seem to be less interactive, things like that. One thing that happens to me all the time is I have people say, wow, you're a vet. This must be such a hard job. You have to put pets to sleep. I couldn't do it. Honestly, it's not that it's a hard job. I would say that this sometimes can be one of the most rewarding parts of my job, especially if it is a pet or an older pet that is suffering. Okay. In human medicine, we don't have really euthanasia. You just have hospice, and you have to watch you have to watch humans suffer. In veterinary medicine, we are able to end the suffering before it gets to a point, that is that bad. So as being a veterinarian, yes, I don't like having to put pets to sleep, but at the same time, I don't want a pet to suffer, and it can be rewarding. There are a couple of companies or different options, I should say, if you decide that it is time for your pet. And before you decide if it's time for your pet, I always recommend that you go to your primary veterinarian to kind of have that talk. There are at-home euthanasia companies. In particular, there's one company called Laps of Love and another one called Gentle Crossing. They will come to your house and they will do at-home euthanasia. If that's not an option for you, you don't want to do that, your regular vet can also assist with that. And unfortunately, sometimes pets decline very rapidly, and it can happen during the weekend or emergency hours. And any of the emergency hospitals, including us, we can help assist that, okay? And make it as peaceful process as we can. Hopefully for Pepito's sake, that he's not ready to go. But when it is time, Jose, or you think that it is time, your best bet is to contact your regular veterinarian and have that discussion with him or her. All right, this question comes to us from Anisha, who reached out through our YouTube. Hi, Dr. Carter. Our tabby Timothy isn't getting any younger, and as such, we'd like to know what kinds of subtle signs he might present that let us know he's aging, needs a little extra assistance, or even in pain. Hi, Aisha. What a proactively thoughtful question. Timothy is very lucky to have you. So I'm going to say this. Cats are very good at hiding pain. Dogs are good at hiding pain. Cats are even better at this game, okay? So sometimes the signs of pain can be very, very subtle. I would certainly say if you notice changes in their appetite as far as decrease or not wanting to eat, that is one sign. If you notice that your pet is not really very active. Now, it can be hard in cats to measure this because cats like to sleep a lot. But cats still, even though they do like to sleep, when they are active, they like to be active. If you notice that your pet is not normally playing when you get toys out for it, if he or she is having trouble getting up and going to the litter box, jumping up on counters, jumping up on the cat tower, different things like that. You notice there's significant weight loss. That's another thing to watch out for. Obviously, if you know them like excessively crying or meowing or whining, then those are definitely signs of pain. And like I talked to before, there definitely are some options if you feel like your pet is in pain, as far as if it is due to arthritis out there. So if you have any questions or concerns, Aisha, call your regular veterinarian, get an appointment scheduled, and have that talk, okay? All right, we got another question from our website, allhealthtv.com. You guys definitely need to go check it out. It's got a ton of useful information on there. And this question is from Nanette, who asked, Hi, Dr. Carter. We have Andres and a cat, Annabelle, who are inseparable and both are getting on in years. We'd like to know how often we should take our senior pets to the vet. All right, this is a really good question. Okay, any pet, doesn't matter the age, they should be having regular checkups with your vet every single year. So for every year that we age, your dog and cat ages an average of 7 years. So if you do not take your cat to the vet for 3 years, that's like not going to the doctor for 21 years. And there's a lot of things that can happen in 21 years. All right. Yearly blood work is something that I definitely recommend in pets. I would say probably for dogs the age of 8, cats maybe around the same thing, 8 to 10 years old. There is specific senior blood work that can be sent out from your veterinarian's office, or they might be able to run it in-house that can check internal organ function, can check hormone levels, can check for all kind of different things. Now, as your pets start to get older, I would say maybe probably around the age of 10 to 12, they need to go to the vet every 6 months, okay? Because that's going to be about 3.5 years, all right, that they've aged. Now, if they have a specific medical condition, such as diabetes, if they're hyper or hypothyroid, if they have Cushing's disease, if they have heart disease, things like that, then the checkups may need to be more frequently, and it may need to be every 3 or 4 months. The best thing is if you have concerns about this, is go to your regular vet, and your vet is going to advise you on when you need to bring your pet back. So hopefully that helps answer your question. All right, we've got another question from Facebook. This one is from Sunil. Good day, Dr. Carter. My brother-in-law Rohit was visiting us from Mumbai last week, and he fancies himself as a pet expert. He suggested that we give our aging boxer Ganesh supplements like glucosamine or omega-3s. Hi, so now this is an intriguing question. These are my thoughts on it. Yes, supplements are great. They are not going to hurt your pet whatsoever at all. All right. Omega-3s, just like they have benefits in humans, they have benefits in pets. In particular, it can help with heart health, joint health, with skins, with bone, all that kind of stuff. And definitely, actually, even with brain function too. So basically, it helps with inflammation. There are a lot of different supplements out there. Your best bet is to speak with your vet, find out what they recommend. Now, as far as glucosamine, typically there's a supplement that has glucosamine and chondroitin in it. And there are a lot of different brands out there, so talk with your vet on what they recommend, but I certainly do recommend that supplement also. Chondroitin basically inhibits an enzyme that breaks down cartilage, and glucosamine helps rebuild cartilage and new connective tissue. So these supplements are definitely a must for your pet. So, but if you have any concerns or if you want to know which one is best for your pet, then make an appointment with your primary veterinarian and they're going to be able to advise you. Okay? If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's another chance to find out where to send in your health-related questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
The next one in our queue comes from Tova on our Instagram page. Hi, Doc. We are not exactly sure how old our Yorkie Petunia is as we got her from a shelter, but we think she's at least 11 years old. She's been acting a little strange as of late, and we want to know how we can tell if she's developing dementia or cognitive dysfunction. All right, Tova, that's an important question. So yes, pets can actually develop something called cognitive dysfunction disorder, okay? It is basically similar to Alzheimer's in humans. And there's an acronym, basically it's called DysHAL, that kind of explains the signs that your pet may see. So certainly disorientation is one of them, okay? Abnormal interactions, issues with their sleep-wake cycle, which may mean normally when it's nighttime and they should be sleeping, they're up and they're walking around and keeping you up. And when it's daytime, they're just passed out. Another one is house stoling. So if normally your pet was very well potty trained and then all of a sudden they start to have accidents in the house, that can be a sign. Definitely changes in activity is another thing. Just overall anxiety, being very nervous, being very anxious when otherwise they were normally a very calm and quiet pet. And then definitely learning and memory changes. So if your pet once used to be able to go and fetch the ball or was able to do some tricks and things like that, and all of a sudden they seem like they don't know what's going on or they don't know how to do it, that can be a sign too. Now, as far as treatment, you can't do anything as far as to prevent it per se, but there definitely are some treatments out there to kind of help make your pet more comfortable. There are some diets out there that help promote brain health, and you can talk to your regular vet about that. There definitely are supplements out there in particular, as far as supplements, supplements that have antioxidants, something called medium chain triglycerides, which are basically fuel for your brain. A lot of the supplements have that. There is a medication, they're called MOIA inhibitors. They're used in humans and they have been used in dogs for cognitive dysfunction disorder. And then there's something called cognitive enrichment. So there's some activities and things like that that you can do with your pet. If you want some more information about this, go to your primary veterinarian, or you can certainly get online, and there's definitely going to be a lot of resources. So hopefully your dog Tova is not suffering from that, but if he or she is, definitely there's things out there that you can do, okay? All right. Trace just reached out to us through our YouTube page. Here's his question. Hi, Dr. Carter. I'm concerned about our 3-year-old cat, Mr. Bigglesworth. Mr. Bigglesworth, I know, our daughter named him. Anyway, he's been lethargic lately, and we're not sure, but we think we saw some blood in his stool. So we want to know, how can you tell if your pet has cancer? All right, Trace. So it can be difficult to determine if your pet has cancer. just like it can be difficult in humans. It's actually harder in pets because pets can't talk to us, okay? There are some newer tests on the market that have just come out that are actually blood tests that can help detect certain types of cancers with about a 50% predictability rate. That means 50% of the time it can find the cancer. In particular, there is a new test called NU.Q. It is offered by a company called IDEX, and it detects 7 different types of cancer. There is another test that is called OncoK9, and it's very similar to the NUQ, and it can detect cancer 50% of the time. Other things that can be done to try and detect cancer would be is on blood work sometimes. I would say the majority of most cancers, unless it's type of cancer of the blood, like leukemia or something like that, you can't necessarily pick up. But once again, having yearly blood work done on your pet is one way to try and check for that. If you notice your pet has any abnormal growths or lumps and bumps that all of a sudden pop up, okay, they certainly can be benign, but they can be cancerous. Make an appointment with your vet. Your vet may want to do a fine needle aspirate, or your vet may say, hey, let's remove this mass and let's send it out for biopsy. That's another way you can detect different types of cancer, especially ones that can affect the skin. Obviously, radiographs is another way. Sometimes cancer can spread to other organs, such as the lungs. So if you see evidence of tumors or nodules, that can indicate that you've got cancer. Ultrasound is another good way to detect cancer as far as looking, especially with the abdomen, masses on your liver, spleen, the pancreas, like any of the organs in the abdomen. Obviously, CT, we do CTs and MRIs on animals. That is another way that cancer can be detected. Your best thing is just to honestly bring your pet to the vet every year, okay? And if you notice subtle changes in them, even if it doesn't seem that concerning, I recommend making an appointment. Unfortunately, sometimes cancer cannot be picked up until it's too late. And those are cases that I tend to see in the ER. In particular, I see a lot of what we call hemoabdomens. So that is basically when your dog comes in and they have got blood all throughout their belly or the abdomen. Usually that is caused by a tumor that is on the spleen or that is on the liver that has suddenly ruptured. And in those situations, surgery can be done. And a lot of times we don't know if it's cancerous until we go and we remove that mass and we send it out for biopsy. But that is the most common type of cancer that I tend to see in the ER because these dogs come in and they've all of a sudden been very lethargic, or they have collapsed suddenly, their mucous membranes are pale, different things like that. And those are certainly emergencies. A lot of the other types of cancer, sometimes the signs can be more subtle. So if you do have any concerns, if your dog's got any new lumps or bumps, especially if you got a boxer, okay, they're known for getting mast cell tumors. Take your pet in, okay? Be proactive. There are oncologists, and cancer is not always an automatic death sentence with your pet. We have wonderful, wonderful oncologists in the South Florida area, and I know lots of pets that get chemo, that get radiation. They tolerate chemo way better than humans do. They don't lose their hair. They can sometimes get a little bit sick, and there can be some complications, but these pets do tend to do a lot better. So just because your pet is diagnosed with cancer does not mean that you need to put your pet to sleep. There are some cancers that can go into remission. There are some cancers that have some new treatment. There's actually like a vaccine or an injection, I think, for melanoma out. So if you have any concerns, follow up with your regular vet. If your pet is diagnosed with cancer, I definitely recommend going for a consultation to see a board certified oncologist. They're going to be able to give you the best information out there as far as what type of cancer your pet has, what the prognosis, and what your treatment options and stuff are. Okay. So hopefully your pet doesn't have cancer, but if they do or they get diagnosed with it, please know that there's a lot of options out there for your pet to help make them, be comfortable and to extend their lifespan. All right, this is another question from Facebook. This is from Billy. All right. Hi, Dr. Carter. Our beloved dog Maxwell is 17 years old. We know he's really old and we like to get him a puppy, so we're not so devastated when Maxwell leaves us. Ideally, what kind of dog should we consider? All right, Billy. So this is going to be a really personal question. I'm going to kind of have to make this fast. I would say that you probably maybe want to get a dog that maybe is not such a puppy, maybe that is a little bit older in age. The last thing you want is your poor dog Maxwell, who's 17 years old, getting harassed by a little puppy running around crazy, being super excited, jumping all over him, and things like that. If you do get a puppy, just make sure maybe it's a breed that's a little bit more calmer, okay? And it's not as quite as active. And definitely, like I talked on an episode before, you want to make sure as far as interaction with them, you want it to be supervised. Now, they may turn out to become the best of friends. And if they do, that is wonderful. But definitely when you have an older or senior pet, and they have a little bit of trouble getting up and getting around, and they're a little bit grumpy, the last thing they want is a puppy like, hey, let's play, let's do this, do that, okay? So, good luck basically with trying to find another dog. But remember, like I said on my last episode, that I recommend adopting before shopping. All right. So, guys, hopefully you guys enjoyed this episode and got some answers to your questions. All right. Thank you guys for watching so much, and I will see you guys next time. Okay. All right. Bye.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.